I'm going to share 5 tips to help you perform better on the ACJ exam and increase your chances of passing. So let's get started. Hey everyone, it's Dr. Hafez from ScholarsDental. After helping hundreds of dentists prepare for their NDEB exams, I want to share some tips that could be very powerful and make a real difference on the exam day, especially for the ACJ. These tips are, they're not general exam tips. They're actually specifically for the ACJ exam. So let's get right into it and start with tip number 1. All right, so sorry about that, just a sec. Perfect. Okay, so tip number 1 is read the case, or consider reading the case quickly, then the question, and then coming back to the case. So what we mean by that is when you get a case, don't spend too much time reading every single detail on your first read of the case. Instead, read the case quickly, then go to the question. Once you know what they're asking of you, then you could go back to the case and read it more carefully with the question in mind. So this will save you time and help you focus on what's actually important in the case. So let's kind of summarize that. So pretty much read case quickly, go to question, and then go back to case more carefully. Okay? Or in a more careful or slow or detailed way. So just kind of make this more practical, or kind of give you an example. Sometimes people will tend to read the case, overthink every word of the case and start predicting what the questions could be. So they start thinking like, oh, this patient has diabetes. That means a medical emergency, and this is what's going to happen. And that means in the patient management question is going to happen. And, this tooth is negative. That means this is going to happen. So I've seen some people look at cases that way. Now, that's fine when you're studying, but in the exam, you don't even know those questions are going to come. You might have a diabetes patient, and for example, there's no medical emergency question, just a patient management question. Or maybe you don't get any of those. Right? And maybe they brought the diabetes for a perio question, so that you pick something related to perio with, not going into details, but with the gingivitis due to systemic or influenced by systemic factors, right? So just an example, instead of trying to predict what the question could be, read the case quickly, go to the question, come back to the case now, and look for the answer to that question in the case. And go over all the boxes in the case after every question. So, you go to question 1, you go back to the case, you go to question 2, go back and read the case, every box, and see, is there anything in this part of the patient info or patient case that is helpful in solving this question? Is there anything in this box that's going to be? So every question, I would go back and check everything and just scan quickly, like, oh, blood pressure is not related to that. No, this is not related. This is not related to this. Oh, here, this is maybe something I need to read that will influence the answer in this question. So to summarize, don't spend too much time in reading the case at start. Glance at it quickly, go to the question, know what they're asking, then go back to the case with that question in mind and look for the answers. So that is tip number 1. Now, tip number 2 is, and this is an important one, don't over answer. Okay, over answering in ACJ is usually why many people actually end up failing. So stick to what the case shows you. Don't overcomplicate it by imagining things that aren't there, or trying to outguess the question, or trying to kind of predict there are more problems than they're presenting to you. Okay, over answering can lead to mistakes that could zero your question. Right? If you answer one of the options that is actually wrong, you get a 0 for that question, right? So answer exactly what's asked, nothing more, nothing less. And, I know this is somewhere because people get worried here and they want to find a balance. So let's kind of summarize here. Don't over answer. And I understand because usually, dentists are going to this exam are thinking, okay, if I over answer, I might fail, but also if I under answer, I might fail as well because I'm not accumulating enough points. Now, both those statements are true. However, the harm that comes from over answering is a lot worse than the harm that comes from under answering. So if you over answer and you get one wrong option, it cancels your question, right? However, if you under answer, in some cases, yes, you might just get a 0.5, right? Right? And you're accumulating maybe 0.5, 0.6 on some questions. But other ones, you'll get a full mark because that under answering is actually not under answering. It might be the full answer. You think you're under answering, but it might be the full answer. And also, you want to rely on those choose only one questions where you're getting them right, like the pathos and the ones where it's choose only one. That way you're getting full marks on those. So if you get all the choose only ones correct, or most of them correct, and you accumulate enough points in the partial answers, and some of them are going to be full points, then you could pass, right? So yes, you could fail by under answering too much if it's true under answering, but sometimes you think you're under answering, but you're actually just answering enough, right? And you don't know. So again, don't over answer. That's a worse mistake. And another way I like to argue this is if you want to compare the under answering and over answering, right? The problem of over answering is a habit issue. So it means that you know the knowledge, but you screwed up your answer even though you know the knowledge. So you know the knowledge to answer the question correctly, but because of this habit that, the FOMO, the fear of missing out, you just can't help yourself to answer that additional option. You end up canceling the whole question. However, the under answering, if you end up failing because of under answering, you have the right habit and strategy, but it's more of a knowledge problem. So maybe you needed, to improve your knowledge to pick that second carries. Maybe you didn't train enough to learn how to see those carries, and then you just need more time to get there. So it's an easier thing to fix than over answering, right? When you over answer, it becomes more of a problem of, okay, where did you over answer? Why are you over? You know the knowledge, but it's more of a habit. Whereas in under answering, it's more, if you fail by that, it's because of knowledge. So you want to keep the habit of under answering, or let's just say the habit of not over answering, but fix your knowledge so that you're answering enough to pass. That's fixing your judgment, right? And that's why you train and you practice through courses, is to get that your answering level up to the point where you could pass. But the problem with over answering is you're kind of trying to shoot at everything just to pass, and then you end up failing because you don't know what to fix. So again, that's another argument. Now, to implement this tip, from all the batches of ACJ courses we've done at Scholars, we try to summarize it in a sentence or something to kind of convey it in a way where it's easier for you to implement, right? So for example, we sometimes tell our students, answer what has to be correct. Don't answer what could be correct. This is one way of saying it, right? Or initially we used to say, answer what you are sure of. If it's something you're not sure of, don't answer it. Okay, and then we kind of started saying, okay, well, answer also, use the mindset of answer what has to be done in the which option has to be the answer. Don't use the why not mentality. Like, why not this? Why not that? Yeah, this sounds cool too. Why not? Don't do that. Okay, that could just end up, use the mentality that no, this has to be a treatment option, or it has to be included. Okay, and I think another way of saying it, if that didn't click with you, is to say, don't answer what could be correct, answer what must be correct. So choose the options that must be correct, that you think everyone around you will agree. No one will disagree on this. And if there's an answer or option that could be correct, you're kind of thinking like, oh, this could be right. Well, remember, if it could be right, it could be wrong. And then those ones, you have to kind of use your judgment when you want to take that risk or not. Okay. So that's an important one, that I really do care about. It's a habit thing, and try not to over answer in the ACJ questions. So now tip number 3 is more of a really practical one, is read all the options and exclude them one by one. This works very well with answer only one, or the questions where choose only one, right? But it could also work for other ones, it depends on the question. But a good example is like pathology. So when you have a pathology photo, you look at the photo, there's two ways that you might lean here. One, well, initially you could just say, oh, look, I know what that is. You rush to the correct answer, you pick it, and you're done. However, there's a risk there that you might be missing something, right? So another way, instead of going directly to the answer you think it is, in something like patho where you see a photo, I would go through all the options. Go to option one and say, okay, could this option be that? Maybe it's nope, that can't be that. Look at option B. Could that be it? No. Look at option C. Could that be it? Maybe. Look at option D. Could that be it? Yeah, looks like it. Option E. Could that be it? No. Like, do that, and then you might end up with 2 to 3 options are your differential, and then you might be like, you know what? It's not really C, because C would have been looking like this, or would have been on this tissue. D looks like, okay, let me go see in the patient history, is there anything that could make one stronger than the other? And then also remember what your initial answer was. So I'm not saying don't have an initial answer, but just don't rely on it alone, right? So when you see a photo in patho, you could think, okay, I know that. That's that. For example, maybe it's a mucocele. That's your initial answer. Good. Keep that on the side. Then do the technique of, let me look at all the options and exclude, and see if there's any differential, which one's best, and then kind of see, does the strategy of excluding all the options match with your initial answer? Then you're more confident about your answer. And then because you really need to guarantee those full marks. The ones where you choose only one, you're making one decision and you can get the full mark, versus those partial questions where, like, you're trying to find carries where you have to maybe sometimes find 4 or 5 to get the full mark, right? So you really want to try to guarantee these ones. So it's okay to spend some time to make sure you're confident about your answer in the ones where it's choose only one, okay? So, yeah, let me see if I missed anything. Don't rush to pick the first one that looks familiar. Instead, eliminate wrong answers one by one. So this will increase your chance of picking the right answer. So that is tip number 3. Now, tip number 4, this one actually, the NDEB, when they did a webinar for ACJ recently, just the last month, I think, they actually mentioned it's better not to zoom in. So avoid zooming in the exam. Resist the temptation to zoom in on the radiographs. Of course, the images, I don't think you need to zoom in on that, but the radiographs for sure. Zooming too much can make you lose kind of the proper, resolution. You might end up seeing things like artifacts that you're not supposed to see, that you might assume are caries. So just trust the default view and use your judgment on that. Now, in the ACJ course, sometimes we even looked at big images and looked at them when they were small to see the comparison. And sometimes when they're smaller or when you're not zoomed in, you see the caries better. And that's because of maybe the resolution, the contrast. So, back in the day when I was doing ACJ, people would bring like magnifiers with them because it was on paper. I also didn't really like that. Just look at all that could like make it you're overthinking. You don't need a magnifier to see caries, okay? You don't need to zoom in. Just kind of look at it as an image and say, do I see it or not? And just avoid zooming in. Again, a tip from the NDEB themselves during the webinar. So I would just stick by it, avoid zooming in. Okay. And finally, we're at tip number 5, which is also a good one. It's not something you're doing in the exam, but you want to prepare yourself for it, and also, you implement it in the exam, which is expect changes in the templates and in the options. So expect changes in template. Okay, so tip number 5, be mentally prepared for the possibility that the exam format or templates or answers or layout may change slightly. They might take options from one template and put it in another template, which is common. They might bring a completely new question or template. Sometimes they have done that in the past, where we don't even know about the templates. They might release it all like quickly, or sorry, suddenly in an exam, and it's brand new, and then we know, okay, they're bringing this concept. So just be prepared for that, and don't let it knock you off your game. Okay, so sometimes they might add extra options. Sometimes they might add even, so I said they might take some options from one template and put in another. They might add new options to a template. And they might, so that's like a minor adjustment. They might even bring a brand new template. So don't panic if it looks a little bit different. Stay calm, trust your preparation, and focus on the content, not the format, right? You have the knowledge. So just trust that you are, whatever question comes, trust that it's in the realm of the knowledge you know. That's the best way to do the exam, because what's your alternative? Panic and just not think that you don't know it, and then lose the question automatically. No, the best thing you could do in the exam is trust that you do have the knowledge to solve the question. That will give you the best chances. Okay, whether you have to even pretend that you might know it or not, at least just trust that you do, and then you might get your best chance to solve it. Most of the time you already know it. For example, in one time they brought a question where they asked what's the treatment for candidiasis, and they brought like medications just in a list. Okay, we all know what the treatment is, nystatin. It's not like a new thing, but because the template was different, it's a new concept question, not a new concept in dentistry. You know it from AFK, you even know it from ACJ because you analyze prescriptions, but they just kind of twisted things around. They just asked directly, what is the treatment for this disease? And it's nystatin, right? So then you just pick it. That, like, it's not difficult, but some people, they react to new things in a very negative way, and they get stressed out, and then they freak out, and then it might affect their entire examination. That's what you don't want to do. So if you go in expecting this, at least you'll know how to handle it. Just have the confidence that it's within your knowledge, and you just need to kind of solve the question that you have. Okay. Again, if they bring you a new option in a template, that's fine. They're probably helping you, right? So if, let's say they, a lot of times they might bring a scenario, a disease, or a path, or something where the template doesn't fit that scenario. For example, it might be even a systemic disease, right? Or a specific pathology where the treatment of it is not in the template. So the way they help you is by adding a new option specifically for that disease to make it easier for you, more reasonable, just like how we mentioned, like, in some assessing the liver function for specific diseases, or, let's say they bring you a ranula and the treatment's marsupialization, like stuff like that, right? Where it might not be in the template originally, but they add an option just to match the disease a little bit better than what's already, especially in pharma or prescription analysis. They might, if they analyze a prescription they have and none of the answers fit, they might add a new one that fits better. So think of it not as, oh my God, they brought us something new, we got to freak out. No, think of it, oh, they brought something new. Maybe it's to help us. Maybe that's the better answer. Let me look at it. Of course, use your judgment. Don't just answer it because it's new. But just consider it, look at it and go, okay, maybe this is something to help us because it fits the answer better. Let me think about it twice now because it's a new option. So that's a new options. If they're just bringing options from one template to another, that means you've studied both. So anyway, both options, you just mix up the templates. That's fine. That may just make it more challenging when it comes to some differential diagnosis, but it's not a big issue. If they bring a brand new template with a brand new question, that's going to be new for everyone. So just kind of solve it with whatever knowledge you have and be prepared for that if it does come. So those are the 5 tips for the ACJ exam. As you saw, they are specific, unique tips for the ACJ, not general exam tips. The ACJ is a tricky exam. It's fun to study. It's not difficult or overwhelming to study, but tricky and requires more of judgment and as I say, learning new habits, getting rid of some old habits, or in answering. Because when you come out from AFK, you're used to take a risk on each question, which is reasonable in AFK because you could only pick one answer and you have to pick the answer. If you don't answer in AFK, you'll lose the question. So you have to answer. So you feel like you've done your best. However, in ACJ, answering sometimes, deletes your question, right? You get a 0. You get punished for over answering. So that's where there's a new habit you have to learn. It's a new style where you have to go, okay, I need to know my limits. And I think that's part of why they have it that way. It's like it teaches you, don't answer something you don't know. Only do what you're sure of, right? It's a good thing to learn, that I'm okay with letting go of some points so that I don't answer incorrectly. It's almost like if you're in a clinic and you're like, I don't want to tell the patient something incorrectly, so I'd rather say I don't know. Let me get back to you, right? That's the right thing to do. And it's kind of like you want to do that in the exam. If you're not sure of an option, don't choose it and just say, I don't know that. I know this. This is what I know, and I'll answer it. And most of the time, that will get you enough to pass, or it might be the full answer actually that they're looking for. So again, it's an interesting exam, but it's manageable, especially when you stay calm, trust your strategy, stay focused. These tips, and habits, they're minor things to think about, but can add up and make a major improvement in your performance. So if you found these tips helpful, give this video a like, share it with a fellow ACJ candidate that's going to the exam. It might help them too. Hopefully this all has benefited you. Subscribe for more exam strategies that we'll be releasing. And if you're preparing for the ACJ, or you're planning to prepare for the ACJ or for the AFK, and you need a complete timeline strategy for your NDEB journey, you could visit our website, book a consultation. You may qualify for a free consultation, and we will plan your NDEB journey, draw it all out for you, make a personalized plan that fits your situation, and that's all. So book a consultation and we'll get back to you, and if you qualify for a free one, we'll go through that together. If you're planning to prepare for the ACA or AFK, let us know and we'll try to help you with that as well. Good luck to everybody taking the exam, and I'll see you in the next video.